Chapter 11, Muscular System, Axial and Appendicular Muscles, Part 5. So we are still talking about the muscles in the thigh. Here's our anterior view of the thigh. Now we're moving on to Sartorius. So this muscle that goes across the thigh is Sartorius. Its origin is in the anterior superior iliac spine, crosses around the front, and then inserts into the tibial tuberosity. It crosses two joints. What does Sartorius do? Well, it helps to flex and rotate the thigh laterally at the hip, to raise up the thigh, turn it outward, as it were, laterally. And it also helps to flex at the knee, so move the lower leg at the knee. Then, flipping over to a posterior view, we have Gluteus Maximus, a nice large buttocks muscle. Gluteus Maximus helps to extend the thigh at the hip, so if the thigh is already flexed somewhat, it can help to extend it, lower back down, and even hyperextend. And Gluteus Maximus also helps to laterally rotate the thigh at the hip to help pull the leg out, the knee out laterally. Gluteus Medius. So underneath Gluteus Maximus is Gluteus Medius. Gluteus Medius helps to abduct the thigh at the hip, so pull the thigh, the leg out laterally, and also helps to medially rotate the thigh at the hip. Then we have Gluteus Minimus. Gluteus Minimus is underneath Gluteus Medius. And Gluteus Minimus does the same things. It abducts the thigh at the hip, medially rotates the thigh at the hip, so medially rotates it, twists it medially or inwardly. All right, we also have a series of other small muscles in the back of the thigh. We have Piriformis. Piriformis, the superior muscle. Underneath that is superior gemellus. Underneath that is obtutor internus. Underneath that, inferior gemellus. So piriformis, superior gemellus, obtutor internus, and inferior gemellus. 1, 2, 3, 4. And they all help to laterally rotate the thigh at the hip. So it helps to turn the leg, turn the thigh outward. All right, and then we have this very lateral muscle. It's rather small. It's called Tensor Fasciae lati. Tensor Fasciae lati's origin is the iliac crest and anterior superior iliac spine, and then it inserts into a long connective tissue structure called the iliotibial band that goes down the lateral side of the thigh down to the knee. Tensor Fasciae lati only technically crosses the hip joint. So it helps to abduct the thigh at the hip, so help to pull the thigh out laterally, and also to medially rotate the thigh at the hip, to twist it inwardly. All right, flipping to some lower muscles on the posterior side, we have the hamstrings. This includes biceps femoris. Biceps femoris, the more lateral muscle of the hamstrings. Origin, ischial tuberosity, and linea aspera of the femur. And its insertion is the head of the fibula on the lateral side. And it helps to extend the thigh at the hip. So if the thigh is already flexed or pushed out anteriorly somewhat, it'll help to pull it back posteriorly. And then it also helps to flex the leg at the knee, to bend the knee joint, as it were. Then more medially is semitendinosus. Semitendinosus, this hamstring's origin is the ischial tuberosity. Insertion the proximal medial surface of the tibia. Again, crosses two joints, so it helps to extend the thigh at the hip and flex the leg at the knee. And then underneath semitendinosus, we have another muscle, the third of the hamstrings. This muscle is called semimembranous. Its origin, ischial tuberosity, insertion the medial condyle of tibia. And its job is the same as the other two, extend the thigh at the hip, flex the leg at the knee. So all three hamstrings perform the exact same actions. All right, back to an anterior view. Now we're going to the quadriceps in the anterior compartment. First up is the central muscle, the rectus femoris. Rectus femoris' origin is the anterior inferior iliac spine, and it inserts into the quadriceps tendon that goes to the patella and down to the tibial tuberosity. So the rectus femoris crosses two joints, the hip joint and the knee joint. What does it do? It extends the leg at the knee, so if the knee's bent, it'll straighten it out. And it'll also help to flex the thigh at the hip. So if the thigh is already straightened out, it'll help to bend it to pull the leg up anteriorly. The quadriceps femoris group has 4 muscles. So next up is the Vastus medialis and Vastus lateralis. The origins for Vastus medialis is the intertrochanteric line and linea aspera of the femur, and it inserts into the quadriceps tendon that goes into the patellar ligament to the tibial tuberosity. And so it only crosses the knee joint. Vastus lateralis, its origin is the greater trochanter and linea aspera of the femur, and inserts into the quadriceps tendon, which leads to the patella, which leads to tibial tuberosity, and And vastus lateralis also only crosses the knee joint. So these two things only extend the leg at the knee. They straighten out the knee if it's already bent. And finally, underneath rectus femoris, if you remove rectus femoris, you will see vastus intermedialis. Vastus intermedialis' origin is the anterior lateral surface of the femur, and it inserts into the quadriceps tendon, which leads to the patella, which leads to the tibial tuberosity. What does it do? It extends the leg at the knee. So all 4 of the quadriceps femoris muscle group muscles, all of them extend the leg at the knee. The rectus femoris also flexes the thigh at the hip joint. All right, going down to the lower leg. Technically, this is leg and this is thigh. So going down to the leg, we have tibialis anterior. Tibialis anterior, its origin is the lateral condyle and shaft of the tibia, and it inserts down into the medial metatarsals 1 and medial cuneiform. So it goes all the way down and wraps under the foot a bit. There it is. What does it do? Dorsiflexes the foot, so it helps to raise the foot and toes up, and also inverts the foot. It can help to pull it so the sole of the foot is facing medially. Then we have Extensor Digitorum Longus, which is next to tibialis anterior. Extensor Digitorum Longus, strangely enough, goes down to the toes. So its origin, lateral condyle of tibia, anterior surface of fibula, inserts into the distal phalanges of toes 2 through 5 so that we can raise the toes 2 through 5. Sort of under it, sticking out a little bit, is Extensor Hallucis Longus. Extensor Hallucis Longus will help to dorsiflex the foot and extend the great toe. So Extensor Hallucis Longus, going straight to the great toe, helps to extend the great toe and also dorsiflex the foot. Extensor Digitorum Longus, as I mentioned already, helps to extend toes 2 through 5, but also helps to dorsiflex the foot. So all 3 of these anterior muscles help to dorsiflex the foot. All right, on the lateral side, surprise, surprise, is Fibularis longus. This muscle on the lateral sides, origin is head and shaft of fibula, lateral condyle tibia, inserts into the base of metatarsal 1 and the medial cuneiform. So it goes down and under a little bit. What does it do? It helps to evert the foot, so it helps to turn the foot so the sole of the foot is facing outwards or laterally. And it's also a weak plantar flexor, a weak one. On the back of the leg is this large double-bellied muscle called gastrocnemius. So here's gastrocnemius, calf muscle. Origins, lateral and medial condyles of the femur, and inserts into calcaneus, that heel bone. So it crosses 2 joints, knee joint and ankle joint. So it flexes the leg at the knee, helps to bend the leg at the knee, and also helps to plantar flex the foot. So move the foot downward, plantar flex the foot. Underneath gastrocnemius is another muscle, seen here, called soleus. So soleus, its origin is the head and shaft of the fibula, medial border of tibia. It inserts into the calcaneus. And what it does is helps to plantar flex the foot. So it helps to move the foot so the bottom of the foot is going down. An example of when we plantar flex the foot is when we stand on our tippy toes. All right, we remove soleus. Underneath that, we're able to see this muscle here, Flexor Digitorum Longus, origin the posterior medial surface of the tibia, Its insertion is way down into the distal phalanges of toes 2 through 5, so it wraps under the foot to get to the bottom of the toes. And it helps to plantar flex the foot and flex toes 2 through 5. So it helps to flex toes 2 through 5, flexor digitorum. We also have this muscle here, tibialis posterior, on the posterior side of the tibius. Origin, tibia, fibula, and interosseous membrane. Inserts into the metatarsals 2 through 5 and tarsals. Again, going down to the bottom, helps to plantar flex the foot. And also, since it's on the medial side, also helps to invert the foot, turn the foot so the sole's facing medially. And that is it for chapter 11.